Hello, my name is Brian Casey. I'm editor-in-chief of AmpMini.com, and we are here at the 2013 edition of the Radiological Society of North America meeting in Chicago. Right now we have with us Dr. Mary Morrison Saltz. She is a radiologist at Stony Brook and also a frequent columnist for AmpMini.com. Dr. Saltz, thanks for being with us today.
Thank you so much. It's an honor to be here today, and I am so excited, as always, to be at RSNA.
Yeah.
It's a great meeting, and it's lots of fun. It's a big party, and I've been coming for longer than I'd like to say. This year, it's really special because I think, again, we see how far we've come in radiology with technology bringing us to yet another level of expertise and exciting new things. One thing that struck me as I was sitting in this very conference room yesterday, listening to a talk about radiologists, about how we need to be more efficient, that we have to have the right temperature in our room so that we can work harder and faster and be more productive and read more reports. I felt kind of sad because I feel that sometimes the very technology that has brought us to where we are today somewhat traps us in a world where we're not able to do what we really do best, and that's be doctors to patients, consultants to other physicians, and take care of people. And I really think that's why we went to medical school, and it's a tremendous strength that we all share.
What There's been a lot of discussion here at this meeting about the power of partnership. How can radiologists be more visible to patients? How can they be more visible to referring physicians? And this is a topic that you've covered a lot in your columns for Aunt Minnie. Do you see a technology solution to that, or is it something a matter of just getting radiologists out of their reading rooms and out into out into the wards?
Well, I think it's a little of both. I think that we need to step out of our reading rooms, out of the dark boxes in which we live, a little bit like animals sometimes in a cage. We need to leave that behind, but we can't do it by simply leaving the work. We've got to continue to work, and so I think that we can use technology to help us do perhaps some of the more mundane things, to allow us the time and energy to free ourselves to go back to, again, the patients and forming partnerships with our hospitals, referring clinicians, and the greater community outside of the Department of Radiology, outside of the university, and beyond into the actual communities in which we live and practice.
No, what sort of things are you doing at Stony Brook to kind of make this vision happen?
I've only been there a couple of months, so I'm beginning now to go out and meet all of the doctors who are referring us patients. Yesterday, no, actually this morning, a survey went out to 500 of our referring doctors in the Stony Brook family to see what are we doing right and what are we doing wrong, and how can we help them better meet their needs. And I'm going to be very interested to see what they say, because sometimes it's not what we think. We are beginning to look at putting in place patient portals for giving of results for radiology, imaging findings, and generally right now I'm just trying to get to know everybody.
Very good. Well, thank you very much for being with us today.
Thank you all.
All right, enjoy the rest of your RSNA meeting.
Will do. Thanks very much, Brian.
All right, signing off for AntMini.com, my name is Brian Casey.